Pregnant women infected with the novel coronavirus stand a higher risk of becoming severely ill, according to healthcare professionals who have been monitoring COVID-19's adverse impacts on expectant mothers and their infants. Thousands of pregnant women across Southern California have tested positive for the novel coronavirus in the past 6 months. And while 2 women with pre-existing health conditions have died from the virus, medical professionals say most have recovered from their illnesses, and most babies born to COVID-19 infected mothers have tested negative for the virus. According to the Centers for Disease Control, 798 pregnant women in the United States tested positive for COVID-19 from January 22 to September 8. Not only are pregnant women at greater risk for severe illness compared to non-pregnant women, the CDC says, but pregnant women with COVID-19 might have an increased risk of adverse pregnancy outcomes, such as preterm birth. At Providence St. Joseph's of Southern California, which operates 10 hospitals in Orange, Los Angeles and San Bernardino counties, more than 15,000 pregnant women have delivered babies in the past 6 months, and 1–2% of them, 150 to 300 women, tested positive for COVID-19, said Dr. David Lagrew, medical director of women's services at Providence St. Joseph Hospital in Orange, which handles about 300 to 400 deliveries a month, has had the highest number of COVID-19 infected pregnant patients on a weekly basis in the Providence system, Lagrew said. 9 to 10% of the people walking through the door were COVID positive, Lagrew said, noting that the majority of the women who tested positive for the potentially deadly virus were asymptomatic at the time they were tested. Few expectant mothers, however, became severely ill, Lagrew said. We've had 3, maybe 4 mothers who have had to go into intensive care with more severe illnesses, he said. Dr. Chen, an OB/GYN at Beverly Hospital in Montebello, said about 5% of the pregnant women he has treated since March tested positive for the novel coronavirus. Chen said none of the women required hospitalization, but rather were told to self-quarantine at home. I haven't encountered anybody who's had any long-lasting effect, Chen said, adding that the recovery rate for his COVID-19 infected patients is 100%, and none of the babies born to mothers infected with the virus has tested positive for it. Pomona Ramos, a patient of Chen's who delivered a healthy daughter, Nellie, on Tuesday, September 8, at Beverly Hospital, said the fear of contracting COVID-19 weighed heavily on her mind while she was pregnant. I was worried about it all the time, said Ramos, 25, of Montebello, in an interview. Me and my husband, we got tested twice, first when we found out I was pregnant and again later on. We are COVID-free.